With age comes a lot of changes, whether that be getting gray hair, wrinkles, or even experiencing joint pain. But for women in the United States, turning 40 means you need to start getting mammograms every 2 years to screen for breast cancer. Mexico, just like the United States, recommends and also covers mammograms every 2 years starting at the age of 40. But other countries, like France, used to not recommend mammograms until the age of 50, but have recently changed their protocols. While all three countries have free breast cancer screening, they are all experiencing the same problems. They're all having problems getting individuals to participate in these screenings every 2 years and keeping up with the protocols and precautions put in place by doctors. Breast cancer is a very aggressive form of cancer that affects women all around the world, and is the most common form of cancer. Let's take a look at how breast cancer differs in the United States and France, which are both developed countries, and Mexico, a developing country. While being female is the biggest risk factor associated with breast cancer, there are several other things that contribute to it. Things like family history, age, obesity, and even lifestyle habits can largely affect your chances of getting it. Two major contributors to breast cancer and cancer in general are smoking and drinking. Now, this is clearly a problem because drinking and smoking is not only a big part of the American culture, but a part of cultures all around the world, developed or not. So the question is, how much are these countries smoking and drinking? In France, about 27% of the population smokes tobacco, which correlates with the large number of incidents that they have, which we'll see later. 16% of Mexico's population smokes tobacco products, followed by the United States at 12%. All right, let's shift gears and talk about what breast cancer may look like in different countries once someone is diagnosed. We know breast cancer screening is free, but are in all three countries, but what about treatment? There's so much that goes through someone's head when they're first diagnosed. Most importantly is what are my next steps? But secondly, how am I going to pay for this? In both Mexico and France, citizens receive universal health care. Healthcare is completely covered at no cost in Mexico and 70 to 100% covered in France. Now, the United States is completely different and does not have universal health care. This is often a driving force for why many women aren't able to receive the treatment they need. Yes, they're able to screen for cancer at no charge, but then they often hit a wall when it comes to treatment. On the other hand, those who can't afford it experience very good success. In Mexico, while research is continuously going on, they're trying to face a different problem. Because citizens can receive healthcare at no cost, physicians are overwhelmed with patients, and patients often have to wait a long time before being able to be seen. This has led to cancer progressing in patients before they're able to see a physician. This is the driving force for why Mexico has such a high mortality rate when it comes to breast cancer. They're trying to implement a system that makes it easier for patients to be seen and treated. France has made improvements in decreasing their mortality rate over recent years. They've implemented the National French Breast Cancer Screening Program. This has led to the detection of breast cancer at even earlier stages, which has in turn led to more treatment options being available. With all that being said, where's cancer the worst? There's a lot that goes into that question, but based on incidence alone, the United States has an incidence of 151 in 100,000 people, followed by France at 99 in 100,000 people, and lastly, Mexico at 45 in 100,000 people. As I mentioned before, France has implemented the National Breast Cancer Screening Program, which has significantly helped with early breast cancer detection. Aside from that, the French Breast Cancer Intergroup has made many advancements, and an increase in success rate has been seen. The United States has made tremendous strides towards trying to find a cure, and research is continuously going on. In the last 5 years alone, the United States has spent $3 billion on cancer research. The United States has had the most success when it comes to 5 year survival rate, at nearly 91%, followed by France at 86 and Mexico at 72. There's another problem that is the most prominent in the United States, but also occurs in France and Mexico, and that is the lack of health literacy. The United States is one of the most diverse countries in the world, which means many people don't speak English. This translates into patients not having the confidence to go to the doctor's office to begin with, because they're embarrassed for not being able to understand what the doctor is saying or being able to communicate back with them. Patients should make an appointment no matter what, because trust me, a physician would much rather make accommodations than to have a sick patient. I've thrown a lot of information at you, so let's recap. Regardless of whether you live in a developed or developing country, there are many risk factors that remain the same, like age, obesity, and lifestyle habits. But many aren't. As I mentioned before, the type of healthcare in the country has so many repercussions when it comes to breast cancer. If you've learned anything from this presentation, it's to never miss a breast cancer screening and to maximize the resources provided to you. If you're ever thinking of moving out of the country, trust me, you want to consider what healthcare system they have. Thanks for listening.